You are listening to the Aging Options podcast with elder law attorney Rajiv Nagaich. As the best-selling author of Your Retirement, Dream or Disaster, and host of 2 hit public television specials, Rajiv Nagaich has emerged as a retirement planning thought leader known for his willingness to disrupt the status quo. In this weekly podcast, Rajiv Nagaich offers piercing insights about the hidden traps in traditional retirement planning advice, along with straight talk about the problems during retirement that money, investments, estate plans, and insurance products don't address. If your retirement plan has been all about saving money, creating an estate plan, and buying long-term care insurance, what Rajiv Nagaich says may surprise you.
Welcome to Aging Options, the podcast. Today, I'm going to talk about Medicare. If you're over the age of 65, or if you've been disabled for at least 2 years, you probably qualify for Medicare. And as always, starting October 15th, all the way to December 7th, that's the open enrollment period. And you're going to be hunted down by every insurance company that sells a Medicare plan of some sort. And most of us are going to be quite confused about, should I buy this plan? Should I buy that plan? How do I decide which is the right one? And because the confusion is so big, majority of Americans are going to sit by the sidelines and not take any action. So what is the right way for you to look at this Medicare open enrollment period? Let's talk about that. First, you should be looking and comparing your Medicare plans every single year. But when you go into the plan, you need to be clear about what you want Medicare to deliver for you. Now, the average person's idea about Medicare is it's a health insurance plan. I want to have the ability to access healthcare if I fall ill. If I have a stroke and I'm paralyzed, I need to be able to go to the doctor for them to save my life. If I have cancer, I need treatments, I need medication. But it turns out even the worst insurance company in America will do a good job after you have a major health episode. But the real point of healthcare, if you really sit back and think about it, what do you want healthcare to deliver for you? It's not just merely access to healthcare, which every company will do. What you want Medicare or your health insurance to deliver is access to care which will keep you healthier longer. Why? Because think about it, the single biggest financial threat that any retiree is going to face is if you fall ill and Medicare refuses to cover the cost, because what you're dealing with is long-term care. If you're dealing with long-term care, the 3 issues that you'll be starting to think about are, where will I go? Will I be able to live out my life at home? Who will cover the cost? Will I go broke paying for it? And who will watch over me when I'm no longer able to take care of myself? You won't have to worry about any of these issues if you're healthy, will you? So the point of healthcare, in my opinion, should be for you to enroll in a Medicare plan, enroll in some sort of a health insurance plan that will give you access not just to care, but to preventative care. And if you're over the age of 65, there's a lot that you can end up doing. For example, when we have children under the age of 18 and the child falls ill, who do we take them to see? A pediatrician. Why? Because the needs of children are specialized. They're different than what it is for the rest of the population. The physiology of children is different. And we want to make sure that we don't miss out on some very obvious sign. Same way when people turn 65 and some would quibble 70, somewhere between 65 and 70, our physiology is different than what it used to be at 30 and 40 and 50. In old age, many times people who are showing signs of dementia are showing signs of dementia because they're on the wrong medication, routinely dispensed by internal medicine and family medicine. You would be better served by having a board-certified geriatric care physician or a geriatric clinic to be your primary source of healthcare. Because empirical data shows people who are in the hands of a good geriatric team, they will deal with depression 50% less than those people who do not have a geriatric team. They will need home care and home health 40% less compared to people who do not have a geriatric team. They will deal with disabilities 33% less compared to people who do not have a geriatric team. Am I making my point? The point of healthcare is not merely to have access to healthcare. The point of healthcare is to have access to care that will allow you to stay healthier longer. And how do you deal with that? Eat right, exercise, socialize, and have the right people on the medical team. Eat right. You want to pick an insurance policy that will give you access to nutritionists. If you're good about eating healthy, maybe you don't need anything, don't worry about it. It's all good. But if you think there is room for improvement, you want to pick a plan that will allow you to access the services of a nutritionist or a dietitian, because they can help you eat better. Even small incremental changes you can make in your diet will help you live healthier longer. Exercise. Pick only the insurance policies that will give you access to a gym membership, whether it is at the YMCA through the Silver Sneakers program or Silver and Fit program, or whether it is to LA Fitness or any of these number of gyms that now are open to allowing you to access their membership through your insurance policy. That's exercise. Socialize. Look for insurance policies that are somewhat linked to volunteer opportunities. In a previous podcast, I had talked about a nuns Alzheimer's study that shows that nuns have Alzheimer's, but they never show the signs of Alzheimer's. Why? Because they're leading meaningful lives. They're meaningfully engaged with life. They're always beholden to other people. Same way, when you're not a nun, you could reduce your risk of succumbing to dementia issues by leading meaningful engagement or having meaningfully engaged lives. You're volunteering. You're looking out for other people. Your mind is always looking up. I got to get up tomorrow and do this and do that. That's the exercise your mind needs to keep you stronger and healthier longer. Eat right, exercise, socialize, and have the right people on the medical team. That would be a bare minimum, would be a geriatric care physician. These are the things you need to go to the insurance industry and say, these are my standards. This is what I want you to deliver. And when you look at it, understand this about the open enrollment period. The only ads you're going to hear are ads about Medicare Advantage plans. Which ad are you not going to hear? Traditional Medicare. Why? Because no insurance company is interested in selling traditional Medicare. Why are they not interested? Because they get paid a bigger subsidy to push Medicare Advantage into the public. Doctors get paid a little bit more under the Medicare Advantage plan. Insurance agents get paid a little bit more commission by selling you a Medicare Advantage plan. So why would anyone in their right mind, from their perspective, push traditional Medicare, even though traditional Medicare, for most of my clients, is going to be a better bet than dealing with Medicare Advantage? And let me explain that to you. A traditional Medicare plan, it comes to you with deductibles and co-payments. A traditional Medicare plan will only pay 80% of the total bills. That's what Medicare A and B does, right? You have a limit to what they're going to pay. And then you can go in the market, buy a supplement plan. You can buy a traditional Medicare plan. It's called a Medigap plan. You can buy a Medicare Advantage plan. A Medigap plan, they are all standardized. The reason why Medigap was standardized is back in the 1980s, there was a massive hue and cry from the public to say insurance companies are confusing the hell out of us. Then most of the people didn't know how to compare one policy to another because every company had a little different permutation and combination. Everyone wanted to talk about the good things about the plan. Nobody wanted to talk about the bad things about the plan. And so the government got involved and said, hey, stop all this. If you want to sell a Medicare supplement plan, and they came up with the alphabet soup plan, A, B, C, D, F, G, N, K, all that sort of stuff. But here's what they said to insurance companies. You can sell all these plans, but every single insurance company must offer exactly the same coverage under the plan, so it is less confusing to the consumer. And with the traditional Medicare plan, you have advantages, like you can see any doctor of your choosing. They don't have to be on their list. Any doctor who's accepting Medicare, you can see. If you happen to be visiting Florida on vacation and fall ill up there, you will never be out network. You should be able to access the services of a dietitian without having to go to your primary care doctor and say, hey, give me a referral for me to see this specialist. These are all the negatives about a Medicare Advantage plan. You want to see a specialist, go to the primary care doctor, and sometimes the wait is about 2 or 3 months before you can even get things done. So traditional Medicare can be a godsend for a lot of people. It can be much better than a Medicare Advantage plan is. But you're never going to hear about this issue. So when you're looking at Medicare this year, this open enrollment, go willingly to your insurance agent or company and ask them to give you a side-by-side comparison of Medigap and a Medicare Advantage plan. In my opinion, here's what it boils down to. If you're willing to pay a little bit more money out of your pocket, get a Medigap plan. Because once you pay the deductible, one-time, one-year deductible, you will never have to pay any more money out of your pocket. Your total out-of-pocket would be about $2,000, $2,400 on a yearly basis. With a Medicare Advantage plan, if you are tight for money, if you are not wanting to pay any premiums, you're superbly healthy today. But even if you fall in, you don't mind paying a little bit more out of pocket, about $7,000, $8,000. Typically, the out-of-pocket limit for most Medicare Advantage plans, then maybe a Medicare Advantage plan will work with you, but you have to work within the limitations of the plan. You can only see doctors who are part of that group. You will probably have higher deductibles and co-payments to make when you access healthcare. And if you get into a year where you have a massive health issue, you may end up paying a lot more than what you would have paid a Medigap plan. So do your homework before this open enrollment season starts. I hope this kind of information helps you. If it does, keep watching other episodes. If you have any questions you want me to go and answer that impact retirement, whether it is in the area of how do I approach my housing issue so I don't have to end up in a nursing home? What about financial questions? Should I buy a long-term care policy? Should I look into a reverse mortgage? What is a financial dashboard? All those questions. If you have any questions, write to us at info@agingoptions.com. That's info@agingoptions.com. This is Rajiv Nagaich for Aging Options, the podcast.
Hello, producer Alec here. Thank you for tuning into this episode of Aging Options, the podcast. If you would like to know more about this topic and many other topics surrounding retirement, aging, and how to ensure that you're able to live out the retirement you deserve, please head on over to AgingOptions.com. If you want a comprehensive, deep dive into planning your retirement and don't want to wait until next week's podcast, I highly recommend Rajiv's best-selling book, Your Retirement, Dream or Disaster. You can find both soft and hardcover editions on the AgingOptions.com website. Please follow us on social media at Aging Options. If you want to see this podcast in video form, you can find us on YouTube, also at Aging Options. Until next week, age on.